Welcome to The Explainer. Today, we're diving deep into the body's constant battle for balance, and we're going to look at the amazing medications that help manage two really common conditions, high blood pressure and asthma. So let's kick things off with a question that gets right to the heart of managing asthma. It's something a lot of people wonder about, and we're definitely going to find the answer as we journey through the body's super complex systems. Okay, first things first, let's understand the problem. Our bodies are these incredible self-tuning machines, but sometimes the systems that control the pressure in our blood vessels and the airflow in our lungs, well, they can get a little out of whack. When we talk about hypertension, that's high blood pressure, it pretty much all boils down to this one simple but really powerful formula. Think about it like a plumbing system, right? The pressure can shoot up for two main reasons. Either the pump, your heart, is pushing out way too much blood, that's your cardiac output, or the pipes, your blood vessels, are just too narrow, which creates high peripheral resistance. Either way, the pressure inside just skyrockets. Okay, let's dig into that resistance part a little more, because a key factor here is something called afterload. Basically, it's the amount of pressure the heart has to overcome just to get blood out the door. Imagine you're trying to shove open a really heavy door against a super strong wind. That's afterload. When it's high, your heart is working on absolute overdrive. Wow, this slide right here tells such a powerful visual story about what's actually happening during an asthma attack. Look at the progression. On the left, you've got a normal, wide-open airway. In the middle, you see an asthmatic airway. Notice how it's already a bit inflamed and thicker, even at baseline. Then boom, on the right, you see what happens during an attack. Those muscles just squeeze down tight, trapping air inside. It really shows you that an asthma attack isn't just some random tightening. It's a huge event happening on top of an ongoing chronic problem. But hold on, before we even think about opening the medicine cabinet, there's this incredibly powerful set of tools that's available to literally everyone. And these are the lifestyle changes that really should be the foundation of any treatment plan. And just to be clear, these are not just some vague, nice-to-have suggestions. These are powerful, evidence-backed strategies. Simple changes like gradual weight loss, getting some regular exercise, and switching to a heart-healthy diet can seriously be as effective as some medications for lowering blood pressure. It can make a massive difference to your overall health. And that recommendation for moderate alcohol intake, it has a very specific definition. It means no more than 2 standard drinks a day for men and 1 for women. And here's the kicker. This doesn't mean you can just save them all up for the weekend. There's no banking your drinks for Saturday night. So what happens when lifestyle changes just aren't enough? Or maybe when someone's blood pressure is dangerously high to begin with? Well, that's when we open up the pharmacological toolkit. We're talking about some powerful medications designed to step in and help restore that delicate balance inside the body. First up in our toolkit is a class of drugs called ACE inhibitors. A classic example is lisinopril. Their whole job is to block an enzyme, the angiotensin-converting enzyme, which stops the body from making something called angiotensin-2. Angiotensin-2 is a super potent chemical that constricts your blood vessels. So if you block it, the vessels relax and blood pressure comes down. Simple as that. And here, this is a perfect example of how a drug's main job can lead to some interesting side effects. One of the classic telltale signs of an ACE inhibitor is this annoying, persistent, dry cough. It's not just some random symptom, it's a direct result of the specific biochemical pathway that the drug is targeting. But hey, ACE inhibitors aren't the only tool in the box. Other drug classes get to a similar goal, but they take different routes. You've got ARBs, like losartan, which don't block the production of that vessel-tightening chemical, they just block its ability to work. Then you have calcium channel blockers, like nifedipine, which do something else entirely. They work directly on the muscle and the blood vessel walls to relax them. This gives doctors a whole bunch of options to choose from. All right, so we've talked about the circulatory pipes. Now let's switch gears and talk about the respiratory pipes. And just like with hypertension, we have a whole specialized toolkit for managing asthma and getting that airway back open. And boom, here it is. The answer to that question we asked at the very beginning. This table lays it all out beautifully. You can see that asthma medications are basically split into 2 teams. On top, you've got your quick relief meds. These are your relievers. Think of them as the firefighters. Their job is to rush in and put out the fire during an acute attack. Then you have the long-acting meds, your preventers or controllers. Their job is fire prevention. They work every single day to tackle that underlying inflammation to make attacks less likely and way less severe. The real heroes of an acute asthma attack are the short-acting beta-2 agonists, or SABAs for short. the one you've probably heard of is albuterol. These are what we call bronchodilators, which means they work fast. We're talking within minutes, to latch onto specific receptors and just open up those tightened airway muscles, giving you immediate relief. You know, the medicine itself is only half the story. How you get it into your lungs is just as critical. Here, we've got two common systems. On the left is the classic metered dose inhaler, the MDI. It uses a chemical propellant to actively spray a mist of medication out. You kind of have to time your breath with pressing the canister. On the right, that's a dry powder inhaler, or DPI. This one's different, no propellant. It's activated by you taking a deep, fast breath, which pulls the powdered medicine right into your lungs. Both get the job done, but the technique is different. And finding the right one for you can make a huge difference. Now, there's another type of bronchodilator, the anticholinergics. And they have a very, well, let's just say a very informal but extremely memorable way to remember their potential side effects. Because these drugs work by blocking the body's rest and digest system, they can cause a drying effect pretty much everywhere, leading to this handy mnemonic. Okay, so we've seen all these different tools in the toolkits. How do we actually use them? Well, it's not about just picking one drug and sticking with it for life. It's all about building a dynamic, personalized strategy that can change and adapt right along with the patient. This chart right here perfectly captures the modern approach to asthma care. It is absolutely not a one-size-fits-all plan. This is the official stepwise guide. You can see the different steps, from 1 all the way to 6, with more medication at each level. A patient starts on whatever step matches how severe their asthma is. The goal is to get it under control, and then, if you can, step down to the lowest possible dose that still works. If things get worse, you step up. It's this constant collaborative process of checking in and adjusting. So when you look at this whole complex strategy with all the different steps and medications, it really just boils down to two simple goals. Goal number 1, prevent attacks from happening in the first place by keeping that chronic inflammation in check. Goal number 2, if an attack does happen, have the right tools ready to stop it fast and effectively. It's a two-pronged attack, prevention and rescue. And all this really leaves us with a final thought. Managing a chronic condition, whether it's hypertension or asthma, it's not a one-time fix. It's an active, ongoing journey. It's a dynamic partnership between you and your healthcare provider, where you're always adapting to keep your body in that sweet spot of balance. It makes you wonder, right? How might your own health strategy need to adapt over time?